Here's some mobility drills for your pelvis that can help take some of the strain, pressure, achiness, or just start to introduce some gentle movement to near your low back region. I love to do this on a chair. We're gonna move in a few different ways. The first we're gonna do is pelvic tilts. We're gonna imagine that our pelvis is full of water. And your pelvis is your iliac crest, where your hands are on your hips here. If you reach down in the front, you'll feel the pubic bone. If you push in toward the front of your pelvis, pelvic area. And then if you reach around the back, you'll feel your sacrum, your coccyx, and the PSIS area. Those bones make up our pelvis, and they move together. We're going to move into a posterior tilt, so that bowl of water is going to tip back. So if that bowl was full of water, now we're tipping it back, and the water is going to spill out the back. I'm going to take an anterior tilt, come forward, and tip that bowl of water forward. So if it was full of water, the water would spill out the front. Rolling through and coming back into posterior pelvic tilt, the water spills out the back. Rolling through, coming through, and anterior tilt, water spilling out the front. The next thing we can do are pelvic hikes. So now I've got my right butt cheek on the chair, my left butt cheek off the chair. I'm gonna drop my left butt cheek down to the ground. And then I'm gonna hike it up and a little higher actually than my right. Drop the left half of my pelvis down to the ground. Hike the left half of my pelvis up to the ceiling. Down and up, down and up. Let's look at that on the right side. I've got my left butt cheek on the chair, my right butt cheek is off. Dropping my right butt cheek down and lifting my right butt cheek off. You may feel different side to side. This is a great way to check in on how your pelvis moves and the control you have. Down and up. One more. Down and up. So we did pelvic tilts, we did pelvic hikes. Now we'll do pelvic rotations. You can rotate the right side of the pelvis forward and the left side back, the left side of the pelvic forward and the right side back. A little twist, a little twist. Right knee forward, left knee back, right pelvis forward, left pelvis back. Left knee goes forward, right knee goes back, left pelvis goes forward, right pelvis goes back. This is some great drills to do on a regular basis just to make sure your pelvis is moving.